Welcome back to more live streaming from Metabolic Health Summit 2022 here in sunny Santa Barbara, California. We just heard from Dr. Robert Lustig. We've had other wonderful interviews today, a number of whom have been speakers or participants, but now we've got Siobhan Huggins, who is an attendee, but really not your average attendee, because Siobhan's got some credibility and some very interesting topics that she's involved in. And one, luckily, I was involved in as well, this recent symposium on using the ketogenic diets for lipedema and lymphedema, a topic that's really pretty new and gaining a lot of attention. So tell us a little bit about the background of this and the symposium and kind of your thoughts on it.
Yeah, so it's been interesting because lipedema was defined in 1940, and there was a lot of confusion over what to do with it for a long time. There's a lot of kind of conservative approaches in terms of compression and MLD therapy and surgery. But the topic of nutrition is definitely a new one. But what we're finding and what the research is kind of outlining is that ketogenic diets can help a lot with lipedema, especially in terms of the pain that can come with it. And so before getting any further, I think an important aspect is to say what lipedema is, because it's not a rare disorder, but it's rarely discussed, which is a bit of a shame. So what lipedema is, and we don't know the full origins of it, but it's a disorder that potentially has some genetic origins, and it results in disproportionate fat accumulation, typically in the lower body. So I actually have lipedema. So I have it from hip to ankle, and then I also have it from shoulder to wrist. So the majority of my body. And if it were just fat accumulation, it's like, okay, maybe that's something like obesity. But the problem is actually that once that fat accumulates, there's also swelling that comes with it, and then also scarring of the fat tissue. And once the fat scars, I personally think there's some evidence to say that that makes it incredibly difficult to lose once it's there. And so you can have this domino effect of fat accumulation that scars over, and then you accumulate more fat over and over again. And it can grow to an extent that it's incredibly disfiguring, for one, but also debilitating. And then you also have sometimes excruciating pain that comes with it. So you have this tenderness of the fat. When you put pressure on it, it can be very painful, easy bruising in those areas. And it is a huge, huge negative impact on quality of life. But that rounds back to ketogenic diets and really comprehensive therapy overall, which is addressing all these different lifestyle factors. Diet is a massive one, because we're seeing huge improvements in pain. And I personally have not really seen any progression since I've gone on a ketogenic diet, except for when I did a high carb experiment. But it's potentially life-changing for people. And so I am very happy to now be working with Catherine and Leslin. And I'm now on the board of the Lipedema Project, which is a 501c3 nonprofit focused on research on lipedema. And part of that is the nutrition aspect and hearing from people with lipedema and what do they need and like all this stuff. So it's very exciting. And there's a ton of research coming out on this now. Like if you just look over the past year, it's magnificent. Not only in terms of nutritional therapies, but really learning to better understand what is actually happening. And it's wonderful. I'm excited to be a part of it.
Yeah, I mean, it's interesting. You can draw so many analogies of other things we've heard today at Metabolic Health Summit, whether it's, sort of treatment-resistant mental health conditions, right? And people don't really know what to do with that. I think lipedema is sort of similar. Like, all right, well, I've told you everything. I know what to tell you to lose weight, and it's not working. So I guess we just can't do much about it. I mean, sadly, I think that's a common response. So to have another avenue to say, wait, there is more we can do, and it's lifestyle. It doesn't come in a pill bottle. It doesn't, it doesn't come in surgery. It's a lifestyle intervention. Is so important. So not only is your movement now drawing attention to the role of ketogenic diets, but just drawing attention to lipedema in general, which more people need to know about. So, I'm sure a lot of it is hypothesis and mechanistic, but why would a ketogenic diet be more beneficial for lipedema than maybe other weight loss diet attempts?
So there's a couple different areas where it might be helping. One of them is just the inflammation aspect, because there's potential tissue damage that's happening with lipedema. Of course, you have inflammation as part of a response to that. And so in terms of ketogenic diets, there's a lot of information that it may be helpful in terms of reducing inflammation from the diet. And then also potentially also contributing to helping with hypoxia that may be occurring. So low levels of oxygen that's in the tissue potentially causing damage. And the fantastic thing about ketones is that there's already been research talking about, in terms of TBI, in terms of a couple other things, that the ketones help produce sufficient oxygen in situations of low oxygen. And it may be that one aspect is that the tissue is becoming damaged because it's starving to death because of that low oxygen. So that's another aspect. So you have the inflammation, and then you have the ketones, and then also there's some research talking about ketones' impact on the lymphatic system. So the inflammation impacts the lymphatic system, and the lymphatic system helps clear fluid out of tissues, which would obviously contribute to the swelling. But there's also really interesting preliminary research in mouse models. So we don't know if this applies to humans yet. But it's discussing ketones potentially signaling new lymphatic vessel growth. So perhaps that's another way. We don't know in humans yet. We do know that we can see a reduction in swelling, but is that due to the inflammation? Is it just due to weight loss? Is it due to this potential signaling effect? We don't know, but more research is coming out. So it's basically, and you'll see this in terms of a lot of things ketogenic diets help with, is that it helps on multiple fronts. And it's just one thing that you're doing. You're just changing your diet, and you're impacting inflammation and swelling and hypoxia and good nutrition and all of the different type of stuff. So it's really fantastic.
Well, you're definitely no stranger to being on sort of the cutting edge or the forefront of a field. First, it was sort of lipids and Lp(a), and now adding this to your mix. So if someone is wondering, could I have lipedema? Could that be an issue that I'm having? Or, can I learn more about the ketogenic diet and lipedema? Where would you direct them to go?
I would recommend going to lipedemaproject.org. There's a ton of resources there, and they also have a Facebook group, Keto Lifestyle for Lipedema. And from there, you can kind of interact with others who have it, and then also take a look at the symptoms. Do you have stubborn fat on your lower body that's not going away? Do you have painful and tender fat? Do you bruise easily in those areas? Do you feel a grainy texture or a lumpy texture within the fat in the affected areas? All of those are potential signs. And then you could potentially go talk to your doctor about it, and they may not be educated about it. Tell them to go to the Lipedema Project also. And then also another important aspect of this is that nearly everyone with lipedema is female. So if you're female and you have those symptoms, that's another check on the box.
Very good. Well, thank you so much for shedding light to this very important topic that so many people struggle with and probably don't know where to turn. So this is great to add more resources and another place for them to go. So another just great interview here at Metabolic Health Summit 2022. And we'll definitely have more live streaming at you. So join us again soon.